Good morning. Today, Aya, Jessica, Jessie, Samantha, Tyler, and Vanessa will be presenting a critical appraisal of a research paper.
The critical appraisal tool used to analyze this study was the McMaster University Quantitative Critical Appraisal Tool, as known as McMaster CAT. This tool provides the basic structure to analyze an article, and it is a well-developed tool created by a research group of occupational therapists. The tool is available in Word documents online, and it allows any person to use a template to critically appraise a research paper. The McMaster tool can analyze the cross-sectional studies, and hence it was applicable to the study design of this particular research paper, as it was a quantitative descriptive cross-sectional design. The template that can be found online for the McMaster CAT is presented in a template format with the following headings to use as a guide: citation, study purpose, literature, design, sample, outcomes, interventions, results, conclusion, and implications. It should be noted that not all these headings would be applicable for every research article. For example, interventions. We will now step through each section of the McMaster Critical Appraisal tool.
The research paper to be critically appraised is titled Caffeine Intake Habits and the Perception of Its Effects on Health Among College Students. You can view the reference to this paper on the slide here. The purpose of this study is to explore caffeine intake habits and the perception of its effect on health among college students. The two research questions that guided the study were: what are college students' caffeine habits, and what are college students' perceptions of the effects of caffeine on health? In the literature review for this article, valid and reliable peer-reviewed articles were analysed with current and up-to-date references between 2012 to 2015. Strong accuracy and relevance of the literature reviewed was presented in the background section of the research article regarding the exploration of perceptions and habits of caffeine consumption in college students. Common trends from reviewing the literature were identified relating to stress and tiredness experienced in students in reference to lifestyle demands. Students' reasons for consuming caffeine were explored, with identified trends of sleep habits and academic demands influencing intake. Research gaps were noted concerning minimal knowledge on perceived caffeine intake effects amongst students and habits surrounding increase in consumption. This study was created to investigate these gaps in knowledge. This study utilised a quantitative cross-sectional study design. This design was appropriate as the research questions do not lead the researchers to establish a cause and effect relationship. Rather, it investigates the current caffeine habits of college students and their perceived effects on health. There are many strengths and limitations to a cross-sectional study design that are relevant to this study. Some strengths include that they are quick, easy, and inexpensive to conduct, given that data is collected only at one point in time. It also allows for multiple outcomes and exposures to be investigated. Conversely, there are some limitations to this particular study design. It is difficult to establish cause and effect relationships, and any associations identified from the data can be difficult to interpret. Another limitation is that this type of study is susceptible to biases. In the event that researchers wanted to investigate a causal relationship between caffeine and health, an experimental study could be undertaken. This design could be carried out by recording biological measures, for example, blood pressure, heart rate, and respiratory rate, before and after caffeine consumption. The data could be used to identify correlations between biological measures and the caffeine consumed by participants. Given that convenience sampling was used, it is likely that selection bias was present. That is, that the sample was selected based on the students who attended the sandwich shop at that point in time, rather than from various areas throughout campus. Given that not all students had equal opportunity to attend the sandwich shop when the sampling was conducted, it is evident that the sample is likely not an accurate representation of the study population.
The study sample totaled 120 participants out of a population of 2,000 college students from northern Indiana. There was an adequate description of the sample with demographic data produced in a table format. 55% of the participants were female and 45% were male. Majority of the participants were aged 18 to 20 years. There was no justification from the researchers relating to the sample size and why they decided 120 participants was sufficient, as that is only 6% of the study population. The inclusion criteria required participants to be 18 years and over and attend the Northern Indiana College as a student. No further information regarding inclusion or exclusion criteria was reported by the researchers. Ethical considerations were well described by the researchers. An institutional review board approved the study prior to the commencement of data collection. Participants were informed of their rights of confidentiality and received an informed consent form to sign and submit to a labeled container upon completing the survey. In accordance with confidentiality requirements, the researchers ensured no names or identifying information appeared on the survey sheets themselves.
The outcome of the study was self-perceived health effects of caffeine among participants. The secondary outcome is the caffeine intake habits of participants, as this was also documented. The frequency of outcome measures is considered point prevalence, as the survey was only administered at one point in time. The measure used to obtain this information was a survey tool, which consisted of 5 demographic questions and 19 Likert-type statements on a 4-point scale. The researchers acknowledged in the paper that as they created the survey tool for the purpose of this study, it has no established reliability. The survey tool was reviewed by peers and hence has face validity. Given that this is the weakest form of validity, further information regarding how the researchers validated the outcome measure would be beneficial. The researchers did, however, acknowledge in the limitations section of the paper that if they were to do a survey at a different point in time, the results might be different.
As the study used a descriptive cross-sectional design, there was no intervention as it does not seek to establish causality or association between two or more variables. Rather, it aims to explore the affirmations outcome measure that are caffeine intake habits and the perceived health effects of caffeine among college students.
The results from this study included demographic information about the college students who participated in the survey, as well as their caffeine intake habits and the effects of coffee on their health. Of the 120 participants, there were 55 males and 65 females. The ages of the participants ranged between 18 and 26 years old. Most of the participants, 95%, were between 18 and 23 years old. There was an adequate distribution of students from freshman year to senior year. Half the college students were enrolled in full-time study in conjunction with having a job, while the other half just had full-time study. The study found that 75% of students drink 1 or more caffeinated beverages a day. The main reason for drinking caffeinated beverages was for the taste. Coffee was also consumed when sleep deprived, just before driving long distances, whenever stressed, and when in social settings. Most participants did not consider themselves dependent on coffee, and most students ceased their caffeine intake once they experienced jittery symptoms. In terms of the health effects of coffee, most students believe that caffeinated products could have long-term negative effects on their health and that it affects quality of sleep. However, most college students also believe that coffee improves mood, heightens their ability to concentrate, improves daily performance and test performance. 25% of students also state that they feel fatigued when they do not drink coffee. The statistical values were not reported in this study, only the mean and standard deviation of each answer to each question. There were no dropouts recorded in the survey, and the study was not created to inform clinical treatment and does not have clinical significance.
A clear conclusion was outlined by the study based on the results that were found. The research questions that guided this study were: what are college students' caffeine habits, and what are college students' perceptions of the effects of caffeine on health? These questions were answered in the conclusion. In relation to the first question, what are college students' caffeine habits? Most college students consume caffeinated beverages for the taste and when experiencing a lack of sleep. They were also more likely to drink coffee in the morning before driving long distances, when in a social setting, and when they were stressed. In relation to the second question, what are college students' perceptions of the effects of caffeine on health? The students who participated in the survey understood that caffeine negatively affects their health, specifically regarding sleep quality. The positive effects of caffeine identified in this study were improved mood, improved ability to concentrate, improved daily performance, and enhanced test performance. The benefits of the study findings were well presented. The findings can be used to promote healthier sleep habits and appropriate caffeine use. The study identified gaps between students in their knowledge about caffeine health effects. Limitations such as sample size and the survey that they had created are clearly stated. Moreover, the recommendations suggest further studies can specifically investigate why students drink caffeine or investigate students' understanding of the specific effects of caffeine.
To conclude, the McMaster critical appraisal tool has been used to critically analyse a research article. There are some limitations of this tool, such as the absence of a section to analyse the quality of the discussion, which contains valuable information about the research and links to other relevant literature. Additionally, this tool does not have a scoring system, and if it did, it may allow readers to effectively visualise the quality of the article. In relation to the critically appraised research article, adequate research procedures have been undertaken. However, there are some aspects of the methodology that could be improved. Thank you for listening.